Everybody. Thank you for tuning in and being here. Um, let's get into some data, and we'll get into some points. Dr. Gupta is here with us today. Thank you for being here, Doctor. You've been very busy. Your team's been very busy. And then we'll take some questions. We currently have 442 cases. That's up from 422 yesterday, so 20 new cases total. Unfortunately, earlier today, we had our 7th fatality related to COVID-19 in our county. Again, our thoughts and prayers are with everyone in this process, but especially with the families of those who have lost loved ones. This was a man in his late 50s with underlying medical issues. He was a Caucasian male. We currently have 43 individuals in the hospital, representing 15% of our active cases. That's up 2 from yesterday. 23 individuals are critical, representing 8% of our active cases. We're starting to track these, just like we're tracking positives and active cases. We're tracking hospitalizations and then how many people who are in the ICUs. The 15% of hospitalizations and out of our active cases has been pretty steady the last few days, as has the 8% of our active cases being individuals who are in the ICU. If you're in an ICU, you're in a fight. Further details on the 43 individuals who are in the hospital: 22 are Caucasian, 11 African American, 3 are of other races, and 7 are recent admissions. We just don't have the demographic data on yet. All of those who have died from COVID-19 in our county have been Caucasian. We've talked about that. We've had 5 males that we've lost and 2 females. Hospital reporting, again, these are numbers from Onondaga County and our hospitals. Our hospitals serve a wider community, all of central and northern New York, from the Canadian border to the Pennsylvania border. So to give people context of how many cases are within many of those counties right now, we have 1,291 positive cases when you add up all the positive cases in those counties. Why do we give this stat now? There's a strong likelihood as this goes on that at some point some of these smaller community hospitals will become inundated from different counties, and then so those patients, the overflow will come into our community and we'll service them. We've said from day one that we've prepared the community in our planning to be ready not just for our county but for all of central and northern New York. Today we have 154 people who have recovered and that have been released from mandatory isolation and quarantine. Again, this is great. We're very happy that these folks have gotten better. Many people get better with this virus. And again, I want to thank our health department for doing a great job with getting these people through the process once they're recovered. So status, 442 positive cases. We are presently monitoring 281 active cases. That's up 6 from yesterday. 46 individuals out of our 442 are household contacts. So these are folks that we knew would be at a higher rate of likelihood of becoming positive of COVID-19 because they live in the same house. So 46 out of the 442 are people that were contact cases. More demographics, 233 of our positive cases are female, 209 are male, 12 are under 19, 95 are in their 20s, 64 in their 30s, 65 in their 40s, 83 in their 50s, 63 in their 60s, 37 in their 70s, 19 in their 80s, and 4 in their 90s. Percentage of breakdown, 24% under 30, 39% under 40, 53% under 50, 72% under 60, and 28% are over 60 years old. Breakdown by municipality: City of Syracuse 160, Town of Clay 52, Town of DeWitt 30, Town of Manlius 30, Town of Camillus 27, Town of Salina 27, Town of Cicero 23, Town of Onondaga 22, Town of Geddes 16, Town of Pompey 15, Town of Lysander 12, Town of Skaneateles 10, Town of Marcellus 4, Town of Van Buren 4, Town of Lafayette 3, Town of Atisco 3, Town of Tully 2, Town of Fabius 1, and Town of Spafford 1. Town of Elbridge, no cases, and Onondaga Nation right now, no cases that have been tested and confirmed. Not to say that there isn't cases there. There may be. What does this tell us? Geographically, it's everywhere. It's in every county around us. We need to protect ourselves and our families. And how do we do that? We stay away from each other. Testing. Again, there's criteria on testing. The criteria is given by the CDC and the State Health Department. If you have symptoms, you call your doctor. Your doctor looks at the criteria, looks at your symptoms, determines if you need a test. No community in this country at this point is testing healthy people. If there is lots and lots of tests, healthy people would probably be involved in testing. So in our community, we've been very fortunate that there's not been a day in our community where we have not had tests available to test people that their primary care provider or the upstate triage line deemed necessary for a test. That's very good. We've had 5,888 tests administered. 5,615 tests have been returned, with 442 positive and 5,193 negative tests. Just think about that. 5,193 tests came back negative. That doesn't mean they weren't sick. They were sick with something else. That's been part of this challenge, is that respiratory illness has hung along longer than usual, at greater rates than usual, and so you have to rule out those cases of COVID-19. Pending tests that we're waiting on results right now, we have 534 pending tests. We received 155 tests back since yesterday. Right now, our rate is down a little bit. 7.5% of those being tested are positive. Really, that number is going to be between 7.5% and 8%, probably closer to 8% when it's all said and done. Process after a test, the health department is going to contact you. They're going to interview you, check on your health, your symptoms, but then their investigation begins to find contacts and determine who needs to be in a quarantine, and they'll work on that. Also related to that, quarantines are based off of direct exposure. If you work at a large employer, that does not mean you had direct exposure to everybody. So those who had direct exposure will be put in a quarantine and be contacted by our health department. Anyone who has been tested needs to stay in a quarantine until you get your results. This helps us as a risk mitigation tool. Think about it. If you're tested, you're sick. You shouldn't be spreading whatever you're sick with to the public anyways. We put this executive order in place early on. It's helped us contain a potential spread of this. So it's been a very good thing, but a reminder, if you're getting tested, you're under a quarantine. Okay, let's see here. Gaps in the investigation. We'll go through these again. If you hear us talking about this, this means that there's some level of gap in an investigation, and we want the public to be aware of that and to watch their symptoms if they were at any of these stores. Ollie's Bargain Outlet on 3150 Erie Boulevard East in DeWitt. If you are a shopper at Ollie's and you are there on Monday, March 30th at 9 a.m. to 4 p.m., please watch your symptoms. And if you have any symptoms and are starting to get sick, please contact your doctor. If you are shopping there Wednesday, April 1st, from 9 a.m. to 5 p.m., again, please look at your symptoms. And if you have any symptoms, contact your doctor. Colonial Laundromat, 408 Oswego Road in Liverpool. Tuesday, March 31st, 6:30 a.m. to 2:30 p.m. Wednesday, April 1st, 6:30 a.m. to 2:30 p.m. Thursday, April 2nd, 6:30 a.m. to 12:30 p.m. Again, if you were at any of these locations during these times, please contact your doctor if symptoms arise. But what we've been saying, regardless, if you've been anywhere, we have community spread. Be cognizant of your health each day. Take your temperature each day. Help us do our part and stay in front of all of this. So that is important. Positive cases, again, we talked about this. Our health department is doing a fantastic job working with people who are sick. When they start to recover, there's a process. And we have more and more quarantines, more and more cases each day. The workload is increasing, so we need you to utilize the tools that are available. And certainly, please go to our health department to register all your information on a daily basis if you're positive with this. This helps us. This will help expedite your recovery process when you are better. Who can release you from a quarantine? Dr. Gupta and her team, no one else. Again, please, a lot of you are doing communicating with us via text message. Please do that. Thank you for that. That helps us out a lot. Social distancing, we talked about our enhanced social distancing policies. We've seen improvement in the metrics that are being used. Again, there's no perfect metric. We're sharing with you things that we see now related to social distancing that we believe there's value to that. Social distancing metrics weren't around months ago. This wasn't a popular business. So as we get more and more data and more metrics to look at, we're going to share them with you because these are things we're looking at and we see value in those. But certainly hospitals are using the same tracking data that we're using for social distancing. Upstate, we showed the chart yesterday related to hospitalizations. It's over here. The red line is our path. We had 2 more cases, so we probably somewhat flattened that number from yesterday a little bit maybe, but we didn't flatten the curve. We certainly need based off of that, if we social distance at 50%, we can get to the yellow or gold curve. We need to get to the gold curve. We need to do better than that. So instead of 50%, we need to get to 60%, so we really chart our own curve. That's important. Another thing that we've seen, and I've gotten a lot of emails about, and I'm asking for people's help if you fall into this category, and many of our families do. I'm getting a lot of emails from mom or dad who share children but don't live in the same household. And mom or dad is very concerned about other people and being mom or dad not taking social distancing policies seriously and not really limiting your contact with people outside your own household. This is common sense. That makes mom or dad nervous when their children are on a visitation scheduled event with the other parent, nervous about what's going to happen to their children's public health. This is not something that we can executive order or regulate, but what we can do is ask for your help. Be cognizant of your children's health and who you're putting your children in front of and who they might be in front of. We need to starve the virus, and we need all parents to take this seriously. We've certainly talked to Family Court, and we've asked Family Court to look into this. This is all uncharted territory when you're talking about custody arrangements and social distancing. So I'm getting the emails. I understand what you're saying. That's not something I can fix, but we are talking to family courts so that they're aware of these situations. Saying that, at this time, I would like Dr. Gupta to come up and talk about a couple things. Doctor, why don't you come on up?
Good afternoon. So for last several weeks, you have been receiving all the information regarding impact of COVID-19 in our community. By means of these daily briefings by the county executive, you are able to get the real picture of what is happening in our own community, not in Wuhan City, or in Seattle, or New York City, or New Rochelle, but right here in Onondaga County, in our own backyards. So here is a snapshot of what is happening right here in our own community. The story I'm going to tell you is fictional, but is based on real cases as a combination of what we are seeing during the course of investigations. It is not story of one person or a family, but of many combined. The nights are still cold, snow has melted away, trees remain bare, an old couple sitting at the dinner table across from each other at their home. Wife asks husband, "How are you, honey? You have hardly touched any food." "I don't feel good," he replies. "Why?" "I don't know. My chest hurts and I'm short of breath." "You were coughing all night and felt warm," wife added with a long pause. "Yes, my head hurts too, and I'm aching and nauseous. I can neither smell your cooking nor taste it." He jokes and says, "Honey, have you lost your cooking skills?" They continue to struggle through the evening. He could not eat much and went to bed feeling sick. Woke up with worsening symptoms and was taken to the local hospital by the ambulance in the morning. He was diagnosed with COVID-19 and transferred to the intensive care unit of that hospital. Wife did well for a few days, and then she developed symptoms, which continued to get worse, and she ended up in the hospital as well. She remained on the regular medical floor for now with the diagnosis of COVID-19. After 41 years of marriage, they were in the same hospital, under the same roof, but could not see each other. They don't know what happens next. While this is happening, the community already had more than 100 cases, and press briefings were happening every day, like we do it here. Few days before this, their eldest son, who lives nearby, who normally checks on them on a regular basis, visited them, which he normally does. He wasn't feeling well for last few days, felt achy, tired, some minor cough, loss of taste, thought it was a cold, and he thought, oh, he's working long hours in past few months, and it must be the case. So he spent few hours with them, along with his youngest son, who was coughing and sneezing as well. After parents were hospitalized, son continued to get sicker for the next couple of days and then started to improve. He continued to work, except over the weekends. When he was off, during this time, he kept up with his social circle. The son, that means the grandson of the elderly couple, improved through now son's wife is quite ill. 3 other children in the house of the son are well. An elderly couple's son who also noted that some of his close friends, who he played cards with few days ago, and one of their homes, are ill. He also heard from his coworkers that they are having symptoms similar to his. He also attended a potluck for volunteers to support them in a goodwill, and is now concerned about them. So he was watching TV, reading newspaper, getting information from the Facebook, Twitter, and learning about the new COVID-19, and finally decided to call his doctor and took a test. By the time his symptoms have almost resolved, 48 hours later, he gets a call from the health department. "Hey, this is health department, your test is positive," and start the investigation. During all this time, many other people got exposed to him and now are sick. So when you ask, who are these people? They are families like your and mine. Mom, dad, children, grandparents, friends of friends, and neighbors. What do they do, you ask? Many of them work in our community, from the health system, grocery stores, laundromats, food workers, and many more. How are they doing? We give you data every day, hospital data. How many cases we have? You get that here every day. Where they possibly might be living. What would COVID-19 going to impact our family and neighborhood? You can look at the map updated daily. All of this is possible only because of many dedicated public health staff of Onondaga County Health Department who are working 7 days a week, long hours, to identify these individuals who are tested positive for COVID-19 and are considered infectious. They can transmit the disease to others. it is crucial to identify their friends and family members and coworkers to ensure that we can provide guidance, how to quarantine themselves, and monitor for any signs of sickness. I can tell you this today because I'm looking at these cases. Data comes from people, and every data point is a person. We should never forget that. Remember, many of those who are getting sick during those quarantine time and had hunkered down in their rooms, apartments, and houses, they were able to prevent many more cases in the community. I know it was not easy for them to do, but they did it because they want to protect others. Because this is one of the most important and crucial steps in dismantling the path of this virus. As these individuals developed symptoms during their quarantine, but they were able to stop the path of the virus because they stayed down. I really, truly want to thank them from the bottom of my heart. Their selfless act of giving up their personal freedom to save others and accepting quarantine, they actually protected others. And that brings a lot of joy to me personally during this difficult time, and which is unprecedented time, you all will agree. Every selfless action protects health of others, and we continue to work in this uncharted territory. I want to thank all those. And all of this work to prevent transmission of COVID-19 is possible, as I mentioned, with the everyday's tedious, painstaking work of our health department staff. You are getting truly a virtual picture of impact of COVID-19 in our community every day. This is a Public Health Week, and I want to recognize all my staff in front of you who are working every day, long hours, to protect health of our community. I want to thank them because they are unsung heroes of this public health crisis in our community, and without them, we would not have all this information which is guiding the public policy at the local level, whether school closures, stay-home orders, and many more. And lastly, I am humbled to serve in this role as Health Commissioner under the County Executive, Ryan McMahon, who has been a champion of public health and have put forward strong policies with one and only one goal, to protect health of the community. Thank you.
Thank you, Dr. Gupta. This is Public Health Week, and saying that, Doctor, to recognize you and your staff, I brought you some flowers. Normally I would give you a hug, but that's not allowed. So thank you for everything you've done. You are remarkable, and we are very lucky to have you, and your team is remarkable. To give everybody context to what Dr. Gupta is saying, they're going to be working on Sunday. They're working Saturday. They're working Friday. For many of us in various religions, this weekend's some of the holiest days of our year, and Dr. Gupta and her team are going to be working, doing just that, helping our people who are sick get better and helping to quarantine. And that is critical in this process. So, Doctor, thank you again for everything you've done, the amazing work, and that you'll continue to do for us in our community. I think that story is critical, what Dr. Gupta just said. We've been talking about what we're seeing and trying to have the public understand the reality that our behavior that was normal and well-intentioned behavior weeks ago needs to change, and that's hard. And I think we're getting better at it and we're understanding it more, but you can see in that one example, and again, that wasn't one specific case, I think that brought in multiple cases, but how one example by one individual can lead into 10, 15, 20 positive cases, which then leads into 100, 150, 200 additional quarantines. And then monitoring those quarantines is critical, and our staff has to do that. So we just need everybody to take this seriously for 2 weeks. And the analogy Dr. Gupta made to quarantine, I wish I thought of it sooner, but you have individuals for 2 weeks that are sitting in their room with a bathroom, voluntarily sitting there for 2 weeks because they may have had exposure to this. We're just asking people to change their behavior and modify their behavior for 2 weeks, to stay at home and to do 50% less than what you were doing last week. So the sacrifice that those individuals in quarantine make is a great sacrifice. So again, thank you to our health department, all of our frontline workers. Our community continues to rally to fight a virus, an enemy that we can't see. Needless to say, looking at our plasma project, again, everybody, please, if you're positive in this role, you have a special ability to help us learn about this virus. Please contact Upstate and Red Cross to join our plasma project. Access to assistance. We have some numbers we want to give you and some organizations that we think in these unprecedented times people need to think about if they think they need help. But certainly our Upstate Triage Hotline. If you have no health insurance and or you get referred by your primary care provider, you have symptoms, you contact that line. They're going to screen you for what your symptoms are to determine if you need to get tested. If you then get tested, they'll refer you to the Syracuse Community Health Center. That number, 315-464-3979. Our seniors, healthcare workers, and adult nutrition line, 218-1987. That's a line for folks who need assistance related to getting a meal, maybe getting groceries, maybe getting toiletries, our healthcare workers working odd hours, any of our essential business employees. If you find yourself in this boat, just email us. We'll help you. We'll figure it all out. Again, that number, 315-218-1987. Child Care Solutions, daycare. This is daycare for our essential businesses. We have over 1,000 slots of daycare slots available, free for the month of April. 315-446-1220. We don't want grandma and grandpa being daycare. As much as they want to be daycare, they want to see the grandkids. You heard Dr. Gupta's story. It's that real. Let's try to avoid that. And so we can continue to starve this virus, stay away from each other. Vera House support. There's no excuse for abuse whatsoever. Please contact Vera House if you're in an uncomfortable situation and you need help. 315-468-3260. Again, McMahon Ryan Child Advocacy Center. Right now in our community, many of our mandatory reporters on child abuse are our teachers. They're not with kids every day. If you know something and you're concerned about something, please contact McMahon Ryan, 315-701-2985. Donations of PPE, 315-435-2525. Again, we've had individuals, whether it's 25 masks or 100, that are coming up, stepping up, coming forward, and we really thank them for that. We need PPE to make sure our frontline workers, whether they're ambulance providers, volunteer fire departments, nursing homes, hospitals, all have the protective equipment they have so they can help our people who are sick and they can protect themselves from spreading this virus. Again, Volunteer CNY, we've had many volunteers that have helped us fill gaps within the community. Government is doing different things right now than we usually do. Because there's these gaps. We need people to stay home. We've asked 75% of our workforce to stay home, so we still have more demands than we've ever had. If you want to volunteer your time, please call 315-428-2229. And again, we talk about the mental health challenges in front of us each day and how that's tough. And if you're having these challenges, there is nothing to be ashamed about. Please reach out and get help. One line that can be helpful to you, 211. Talk to some of our mental health professionals. Certainly they can make referrals from there as well if deemed necessary. Saying that, we'll take some questions.
People to social distance, bringing a medical doctor to the podium to tell a story about why it's so critical for people to stay home?
Yeah, can I believe it? Sure, but it does. Is it frustrating? Yes. We've had in this process, we've kind of had peaks of data that might suggest progress, might suggest some of the things we're asking for. Let's create our own curve in Onondaga County. Let this story be one of a success story. And then we have letdowns, I think. I had a conversation with Dr. Gupta earlier today, and Dr. Gupta brought up this point. What we do now, the success we have now, or the failures we have now, will reflect in our data in 2 weeks, 1.5 weeks, right? That's how desperate this situation is. What we do now, if we get our act together now, we won't even see strong the results of our work and our efforts for potentially 2 weeks. And in a community and a society overall that likes instant gratification, that's tough. So no, I think we've been talking about this. I think Dr. Gupta's team is seeing things that we haven't seen in the beginning part of this process, right? In the beginning part of this process, the virus comes, you don't have ability to impact social distancing. It's here. You learn more about it. You know it's here. You start to make these policy decisions. And now we're at a point where we really need the community to rally because we're at a critical junction in this process.
Ryan, I just looking at the numbers. We've got 43 people in the hospital. And you talked about other outlying counties possibly getting overwhelmed and their patients ending up here. So is that 43 just people who live in Onondaga County and are in hospitals here?
Yeah.
Do you have a number of how many people are actually hospitalized in Syracuse's major hospitals?
We could probably bring that number tomorrow. That number flows with the hospitals each day, so the data will probably be a little bit off. But certainly this is COVID-19 related. You have other people there for other things from the county, and then you have these other communities. So that's kind of when we talk about the charts. We want them all to be wrong, right? We want them all to be wrong for the betterment of where we are. But we know if we don't do better with social distancing, we will run into a situation at some point in the month of April where we're putting our hospitals at risk. And so now we need to rally. We need to get that curve, whatever it looks like, whether it's gold, whether it's red or blue, whatever it is over there now, or whether it's a different color, that's even better. That's what we got to do. Because at some point, Chris, if we don't make improvements, our hospital infrastructure is going to be strained. And the reason why it hasn't been strained to date is because of the actions that were taken early on related to testing and making sure testing wasn't done at the hospitals, in the emergency rooms, it's somewhere else, so that we don't have outbreaks of employees and whatnot. So this is critical, and I don't know how much more we can explain how critical this is. And I'll use an analogy I've used a couple times with emails that I've gotten related to different closures of facilities or events that people were mad at me about. I'm an elected official. We all know how I get my job, right? The voters vote for you. Making people mad at you is not really in the DNA of politicians. I've known at this point in time, at every part of this process, when we've made a decision, I was making people very mad at me, and I did it anyways. So that should tell everybody how important this is I don't care if you're mad at me, because the public health is that important, and the actions that were happening in the community were the opposite of what was in the best interest of the overall public health.
Any specific current examples of failures of social distancing?
I think you heard a lot of Dr. Gupta's story was a lot of various potential things that have happened that certainly wasn't one case, but you can add that in. Look, at the gatherings some of these things are amazing, that we're still doing them, or we still think they're happening, even if they're well-intentioned. We can't have the potluck type dinners that you had, even if you're celebrating someone else's sacrifice that they're making. you can't do it. You just can't. We're going into this is Holy Week for many of us, and many of us aren't going to church, right? Passover for others, and so you can't be together. That's unnatural. That's not where we want to be right now. But our answer to that, and to those who haven't taken this as seriously, and say, "Oh my gosh, the flu kills so many more people than COVID-19." Yeah, but we have a flu shot, right? You're not wrong. The data is going to side with you. You have a flu shot. There's ways to treat the flu. There's no way to treat this right now. And the only way we know to treat it is to starve it. So do we want to dive in and really commit ourselves to a process now as a community so that we can get our lives back in May? And what our lives back may not mean 100% restart. Or do we want to continue to have half the public doing the right thing and 40% of the public doing almost the right thing with social distancing, doing it but not doing it quite where we need it to be, and then 10% of the public really not buying in? The margin of error is 0. So we need to get to 50. We need to get more than 50. And if everybody buys in, we'll be in a position to make our case to restart society in the way that everybody who hasn't bought in wants us to.
I want to clarify, though, more than read in between the lines. There's an example of a potluck-style dinner leading to confirmed
There are many
cases.
examples of social gatherings that are well-intentioned gatherings but have devastating outcomes to the public health. And so those are happening. They've happened. And people can use their imagination on what some of these look like. And again, nobody was trying to get anybody sick, but you were sick or you had symptoms or maybe you didn't have symptoms and you went and then you passed it on, and here we are. So how the asymptomatic questions come up. We can't really track that, right? If you're asymptomatic but you have it, how do you not give it to somebody? Stay home, right?
What's the most number of spreaded cases that have come from one social gathering?
We are so busy with our investigations, we probably won't even be able to tell you all the affiliated cases by the time this is all done until our investigators have had months to look at it. These things are quite complicated, and I wish we had that information each day, but it's not. It's just not. Sometimes people don't give you all the answers, and you figure it out later on, but they don't have time to connect the dots on really what are now 400 separate cases with that many contacts. That's how you get to 442.
Of those cases, do you know how many came from people who were in quarantine already, as kind of going off that story that Dr. Gupta
Yeah, I
told?
think at least 42, right? We had 42 contacts, or 46 positive contact households, so those 46 were in a quarantine. Yeah.
How about with the voluntary shelter in place? I know it kind of just started, but in your opinion, has this been working? The even birth years, the odd birth years. Have you been in contact with grocery stores, or is there a way that you've been monitoring it?
Yeah, we have. It'll be interesting. On Monday, I have my call with our grocery store chains, and so hopefully they'll be seeing something. I think, judging my unscientific data in my email box, is the amount of people calling or emailing about people not practicing good social distancing has gone down over the last few days. Unicast, that I don't know if that's today's, if they came up with today's before we got here or not, but we improved. We talked about that yesterday. There's nobody's ever had to track this before, so we got to go with what we have. We still, we know that some of our law enforcement agencies are starting to be more aggressive with social distancing now. They're more comfortable with the guidance that they have. And so I think they're more willing to go into, break things up, utilize techniques, not necessarily arrest people. That's not what anybody wants. We don't want people going into jail. But certainly we've been more aggressive with businesses that may or may not be on the essential line with our law department, giving out more aggressive guidance. So overall, I think everybody, from a government standpoint, every aspect of it understands what's at stake, and what's at stake is getting our lives back sooner than later.
You're keeping a close eye on this curve. Is there a threshold or a specific criteria at which, if we're not improving, you'll consider making these voluntary shelter-in-place orders mandatory?
I think if we look at it's a good question. I would really lean on Dr. Gupta and their team for their guidance on that, because we would have to go to the state and ask the governor for that type of permission. We've gone to the state on golf courses, and they gave us permission to do that. I think he shut them down statewide today. And so we're not ever afraid to be out in front of something if we think the public health could benefit from it. And so I don't want to have to even think about that really, Chris, but I think if we continue to see a spike in cases, or if we started to see, instead of between 15 and 25 cases a day, those start becoming 45 and 55 and 65 a day, I think that is clearly a new intensity of community spread, and that clearly social distancing is not working, and the community has moved on from wanting to participate in that. Then I think you need to look at new tools and so then I think that how you get there is if there was really a collapse in the social distancing efforts, and our health department thought we needed to do more, then I think we start having a conversation with the state about what that looks like. What did they do? What are different things they did that they saw? But what some of the things that, when you have a total community spread in your community like we do, using geographic tools aren't at your disposal like they did originally with New Rochelle. So it's a good question. Really, the one remedy we have to this is to kind of stay away from each other and utilize technology. If you're going to see somebody, stay 6 feet away, 20 feet away. Yesterday was my mom's birthday. Happy birthday, Mom. I drove over. She was on her steps. I was on the sidewalk about 50 feet away. She couldn't give her grandkids a hug or anything, but we said happy birthday, and we'll celebrate it when this is all over. So these are the things that you got to do right now, because I don't want I don't want to have to worry about my mom or dad getting sick because of me not following, really what are smart guidelines that have been given by the medical community.
How about parks? I know that you guys are assessing it on a day-by-day basis.
Yeah.
Any other concerns with social distancing there and things like that?
Yeah, I think for the most part, we got a lot of analogies from from some people related to parks being just as bad as other things. People need a kind of the ability to get out of the house for their mental health, so we don't want to have to do anything with our Onondaga Lake Parkway. Obviously, we've shut down some of the parking lots. We did that on purpose. That's going to control. Remember, we're telling people if you go by and you can't park in the park, please go back a different time. And we're also telling them, please only use the parks on certain days based off of the year of your birth. So I got an email from somebody who lives on the parkway today. She told me yesterday was a great day. I think the weather was okay yesterday. It was a great day from not as dense and people really being cognizant and staying away from each other when they're there. So that's what we want to hear. We know out in Skaneateles they shut down a trail because that wasn't happening. So I think we want to keep parks open for the public to use. Parks the programming of parks are closed, and the playgrounds are closed, but we've kept the ability to access them to the public open, really for everyone's mental health and their well-being.
You have the per capita style map on one of the boards.
Yeah.
Is there a town or a neighborhood cluster that's particularly alarming to the county?
Yeah, I think related to the towns, a couple of them are, and I wouldn't say alarming because the numbers are still so small, but based off of population, they show out. It only takes, to get some of these numbers, it doesn't take a lot of cases to actually get this many people who are positive, right? It could take one case and then they expose so many people with affiliations, and that's how you get to your numbers. But you had, look at when you get the town of Manlius yesterday had a big bump, right? They had 20 cases, 20, then they went to 29 yesterday. They only got one more today, but when something like that happens, you start to look a little bit and you start to try to see if there's a story behind that and what that might be. But overall, I think when you judge population compared to where they should be, everybody's pretty close. It's just, the reality is just, it's everywhere.
Have you had enough time to explore a story for the town of Manlius?
No.
Shifting a little bit, can you provide any updates regarding what the county is doing for small businesses, such as the Bridge Loan Funding Program, and what is your continuing message to small businesses in the county?
Yeah, so we are reviewing. We've had quite a few applications with the Bridge Loan Funding Program. Again, that's a bridge loan while they go through the SBA process for those loans, which is a good program. I think there might be some delays with some of the banks implementing that. So I believe our loan committee is meeting to do that, but I know we've had well over 30 applications for that. We've also are looking at, we've received some HUD money via one of, I think, COVID-3 stimulus package. Part of that HUD money can get spent on small business lending. That certainly will be part of our plan that we put forward to HUD. And we're trying to identify gaps. So the gaps that a local program can, another local program might not be meeting, what the federal program's not meeting, or a state program, and whatever that gap is, try to find those gaps so we can help. But again, I am dying to get us to a point where we can start talking about economic recovery and actually be able to implement it. But to do that, we need to starve the virus for the next 2 weeks. I mean, so we got these programs to try to keep these companies afloat, keep their employees on the payrolls, knowing many of these businesses have to shut down, have been told they have to shut down, and that hopefully when we can restart, that many of them will come back, and the economy will have enough capital to support them, and we can start to see ourselves back on the mend.
So what are the numbers you need to see in order to start easing some of these restrictions? Do we need to see multiple days of 0 new cases? What are the numbers?
Yeah, I'll rely on Dr. Gupta a little bit, but Chris, one of the things that, again, people, in my head, and maybe I'll be wrong about this at the end of this and I'll admit it, but in my head, testing demand that drops is a good thing. And I've had people say, why is that? We got to test everybody. Well, we're not allowed to test everybody right now. So what we can test, who we can test, have to meet certain criteria because they're sick. So if people aren't sick enough to meet that criteria, I'm under the assumption that that means they don't have COVID-19. So demand in testing that drops, to me, means that we're starting to see the virus, under really pressure and stress, which is good for us, the hosts. So testing demands dropping is something that I've been looking at. And then obviously the positive cases. If we're getting less and less positive cases each day, and instead of getting 20 a week, you're down to 5 to 10 a week, and then testing demands there. I can tell you right now, with 534 pending tests, we have 40 positives there, right, just from the percentages. So at some point, if our pending numbers are 200, 250 each day, that's really good because we know from the data that we're getting those positives down to a point, and we can quarantine and identify and quarantine faster. So that's really the challenge. It's always a moving target, but for us to we're going to always look at the business that can maybe that's non-essential right now, but can operate and still get to 50 or 60% social distancing. We're going to always make the case for that business if it's not contrary to public health for them operating. So I think that is part of what this looks like, is what are the businesses that aren't operating today that in 3 weeks from now, as you start looking at May, that could really operate in a way and meet our social distancing rules, maybe that's how a restart looks, what that looks like.
So it's not, there's not going to be a switch that flips and the economy turned back on. It's a phasing in.
I think so, because one of the things we don't know about yet is, say we get our curve going in the right way, and then everybody just jumps back in it all at once. What if a new curve starts? Because it really didn't leave. So I think that's the balance: is you gotta phase in the economic response, and that everything just doesn't turn back on right away. And that's what I think business organizations are really talking to companies about now, is what does a restart look like for you? How can you do it under the COVID-19 reality right now?
You'll have to remind me of the specifics, but you mentioned an upstate projection that had this county at 500 cases, I think, this weekend.
Yeah, tomorrow.
So are we still in the possibility of being, better than that projection?
This was an upstate. This was IEM, which gives us their projection last week. This is a model they use for New York, and then they go by county. They update them based off of data they're getting from the state. The problem is the state's data is actually delayed from our data. So they had us at 500 new cases tomorrow. So I guess I'm pretty confident we won't be at 500 new cases tomorrow. So from that moment in time when they give us that projection, we'll beat that. But the only way none of this data is enough for me or Dr. Gupta to go to the state health department and to the governor and say, we're ready to get back to business. We got to see more. How do we see more? We buy into what we're talking about and we starve the virus.
Are people still safe going for takeout? Because I know a lot of our businesses are surviving only that way, but that set of rules was established early on in this process.
It's how a lot of us are eating too, Andrew, myself included. So I think you got to wear a mask. CDC is recommending wearing a mask. Wear a mask. When you go to the grocery store, wear a mask. And wear a mask whenever you're outside. That's my recommendation. And I think if everyone does that, and don't throw out your mask after you're done with the grocery store on the ground. Nobody wants to pick that up. We all understand that. So just use the garbage can that was right there. But I think it's good guidance. Everybody can get a mask, homemade masks, anything. But other countries have done it. It's worked for them. There's no reason to think it won't work for us.
You say testing demand going down is a good thing because there's fewer sick people, whether or not it's COVID related. But the test you got back yesterday, they were almost 13% positive compared to the average at 7%. Is that concerning at all?
I think what that is, Trish, is I think in the beginning part of this, there was a lot of respiratory illness still. And so our percentages were lower because people were sick with a lot of respiratory illness. I think as we, and Dr. Gupta, if she thinks I'm wrong, she's the only person allowed to pinch me. But if right now in May, the flu that we're usually used to dealing with around this starts to leave this hemisphere. So my guess is the flu's weakening, and that the tests that are being done, there's a higher percentage of those that are actually COVID-19 related than earlier, because many people are getting tested before that had the flu, not necessarily COVID. The other piece why I think the percentages are higher is we have a lot of people who are in quarantine and may be contacts, so you're always going to have a higher percentage of positives from that group.
Talking about who has the virus, it's been about 2.5, 3 weeks since SU students ended their spring break. Some clearly came back to the area. I was wondering if you have any numbers to say how many people who have the virus in the county are not their primary residence is not here in the county.
No, I don't have those numbers. I will say that certainly, without question, the universities and colleges closing when they did and going to online learning has saved us hundreds of positive cases. Absolutely, without question. Certainly, there's been we know for a fact, because people have told us, and my friend Patrick was an SU student who came back from international travel. So certainly there's cases when students came back positive, probably from international travel, and went home and probably reported to their home counties and whatnot, those numbers. But we don't, we wouldn't talk about specific people like that anyways, but that's a type of analysis that we don't have time to do. At some point down the road, maybe we will.
Last week, you announced a program to offer hotel rooms to healthcare workers.
Yeah.
What kind of response have you gotten to that?
Very good response, and that's something that we know. And again, we talked a little bit about yesterday about how that healthcare worker, we should always just look through this process, not through my eyes, but through Dr. Gupta's, your healthcare worker at Krause or St. Joe's or at Upstate, for what they're seeing every day and why they're so frustrated with the public not really abiding by what is good guidance. They are so scared of COVID-19 that they're dealing with every day that they don't even want to go home and see their family. They're willing to put themselves in a quarantine, and they don't want to be near their own families. That's how scared they are of this virus, because they see it, and they work with it, they fight it every day. So we've set up a program for each healthcare worker at various of our hotels that they don't have to go home, and they can feel comfortable, they can feel peace, and they can go to the hotels.
We haven't had a follow-up yet on any of the locations where there was a possible public spread, the ones that the county health department gave a notice on, several at this point. Do we know if any of those yielded in additional positive cases?
Probably. Doctor, you want to touch on that?
So there are two sides of this. One is employee exposure. So employees, we end up seeing some more positive cases. And the main reason to do the public information for that, it's so small interaction to raise awareness a lot of times, because we don't know. Every customer who talks to a person who's an employee, we have no way, the store doesn't have any way of knowing a lot of times. Even they sometimes look through the security camera. So a lot of those things they are able to hone down to the particular employees. And by the closeness, yes, a few of them have become a case, but from the general public, no. And there won't be any easy answer, because people go different places, right? Because there's a community spread. The person who is going to go to Tops or Wegmans or the laundromat or somewhere, they are crisscrossing different places. At the same time, they are interacting with their friends and family. So that's why it's so crucial to follow those social distancing and staying home guidelines. That is the key to prevent the transmission.
So a few employees got it, but we're not aware of any customers because it's just hard to track.
Yeah, I mean, it's pretty much impossible. And one of the biggest reason to do those sort of informational press releases is that it's in the community. So wherever you go, you have to really be cognizant of that. Wear the mask, wash your hands, stay home if you're sick yourself. I mean, people who are going to the grocery store or going to the pharmacy or going to laundromat, they shouldn't be sick themselves, because they're going to infect other people. So.
How specifically important is it for people who serve food to be wearing masks?
Could you repeat your question?
For people who serve food, people who work in restaurants, how important is it for them specifically to be wearing masks?
So, I mean, at this point, most of the foods, they should be wearing masks. I mean, we recommend everybody to wear masks for the social distancing purposes, because it also reminds other person. If you have, I mean, I have my mask with me here. We do actually at our work, everybody's wearing our mask within our own office spaces, because I'm interacting with multiple people. The similar way we will ask everybody to do, to put your protective gear when you are in a confined spaces, keep the social distance 6 feet or more, and make sure if you're sick, stay home. And one of those things we talk about, the people who are not staying home, I want to highlight some of the organization really have done fantastic job. I have few of them examples which I could not put in my story, was that they were exposure, but they had made such a great policy in there that they were not able, I mean, we were able to find, wow, that's great. And those are the things which gives us joy in terms of that people are listening, people are really following and taking to their heart at their workplaces, their managers, their senior leadership has taken on. And I applaud them, and I wish all of them will do that. And in those situations, we don't have to go nowhere because it's pretty confined and it's taken care of it.
Are you able to name those?
Nope, there's no reason to. The only time...
Well, just to give them credit for doing something
No,
good.
the point is that the point of this is, I don't think it should be curiosity. It's mainly, and they know who they are because we do applaud them. And we want people to follow those guidelines which are given to everybody. So they can tell their employees that this is what we have in place. 6 feet, it means you put the tapes or any way you can come up, you put the mask on. So it reminders for everybody. And keep on reminding your employee on a daily basis.
Anything else? Okay, quick thank you to Russo Produce. They donated fresh produce boxes to the food bank, Salvation Army, the Rescue Mission, and hospital workers. So thank you. We're seeing so many businesses respond and really give back. And certainly the really, really good news, which really puts our community on the map. We've seen what local businesses are willing to do. Tessie Plastics really getting involved with producing PPE and manufacturing PPE for us. But certainly yesterday, the Prevail New York by JMA. JMA, one of our fast-growing technology companies, tremendous team to provide free open-source emergency mechanical ventilation system blueprints to all manufacturers for ventilators. So they designed a ventilator, one that they could have kept for themselves and just built these ventilators and sold them. They realized that the demand is there, that the need for these throughout the country and the world are there. So instead of just keeping their own intellectual property, they have put that out for any manufacturer to use and to make these ventilators that we've heard so much about. So I want to thank JMA and Russo Produce. Certainly that is good news.